Hi, I'm Dr. Larry Chu.
Hi, I'm Dr. Lauren Cornella.
And I'm Dr. John Fox.
Now in this segment, we're going to talk about an overview of the field of cardiac anesthesiology. Now what I'd like to do is to have both Lauren and John have a little discussion. I want you to tell me a little bit about the overview of cardiac anesthesiology. What is the practice of cardiac anesthesia? What do cardiac anesthesiologists do? Tell me a little bit about why you guys got into the field. And of course, I also want to know a little bit about the future of the specialty.
Well, Lauren, Dr. Chu, I got into the specialty because it was fun. I was able to take care of really critically ill patients. I was able to learn and study the physiology, the cardiovascular physiology, and ultimately I was able to participate in operations where the patients got better, where there was indeed a cure, if you will. It's like aortic stenosis, mitral stenosis. Once you operated on that and fixed the valve, the patients did a lot better. It followed my personality. That was what I had, what I found the best of it, of cardiac anesthesiology. Additionally, it gave me the confidence to take care of any ill patient throughout the operating suite. Once you've done a cardiac anesthesia rotation and you've learned about the medications, the vasoactive and vasodilator drugs, that you could translate to any other patient for any other procedure. And that to me was great. The other thing I enjoy about the cardiac anesthesia area is the teamwork that's involved. You get really close with the individuals who are there and understand what happens, how you can take care of individuals. It's really, as I said, I found it really fun.
I went into cardiac anesthesia for many of the same reasons that John did, that you did. I thought what attracted me was the ability to take care of really sick patients. I wanted to be very comfortable taking care of some of the sickest patients in the operating room, and I wanted to be comfortable with a lot of different hemodynamic drugs, a lot of the monitors that we use in cardiac anesthesia, and so I saw it not only as a cardiac anesthesia fellowship, but maybe a fellowship in just taking care of some of our sickest patients in the operating room, and I knew that I would translate some of those skills to my practice in the non-cardiac ORs. I also saw how much transesophageal echo was such a big part of the cardiac anesthesia specialty, and I thought that it was absolutely just a really important skill to learn. I saw the cardiac anesthesiologist that I was working with making decisions about the hemodynamic status of the patient, discussing the surgical aspects of the valve replacement or whatever we were doing with the surgeons, and I saw that transesophageal echo was being used so much more in the non-cardiac ORs to answer really difficult intraoperative questions that I wanted to become an expert in transesophageal echo. So I thought that that was really an important aspect, and I was excited to learn more about that.
Yeah. And what Lauren is pointing out is the actual teamwork approach that we end up doing as a cardiac anesthesiologist. It becomes, and I will add parenthetically that when I started in cardiac anesthesiology, there was no transesophageal echo. Innovations come really quickly in the cardiac anesthesia realm, brought on by the surgeons, brought on by the cardiologists, and the other cardiovascular specialists who we have the pleasure of working with. And I know for a fact that there are multiple innovations that are happening right now in cardiac anesthesia. And I know Lauren and I spend a lot of time in the electrophysiology lab and in the cath lab.
I think that speaks to Dr. Chu's question of where we think the specialty is going. I think that, like John says, the innovations in cardiac anesthesia, cardiology, cardiac surgery are rapidly becoming more and more complex. And we as cardiac anesthesiologists are at the center of a lot of those procedures. So just as we're maintaining our presence in the cardiac anesthesia ORs, we're in the electrophysiology lab, we're in the cath lab, we're up in the cardiac surgery ICUs. And so I think our role is expanding very rapidly in the future in terms of kind of the perioperative care of the cardiac
Absolutely.
patient, and we are really an integral part of that, and so I'm really excited to see that develop in 5, 10, 15 years.
And we're taking the lessons we've learned in the cardiac anesthesia operating room in terms of teamwork, checklists, the surgical pause, and advancing that and putting that into cath lab and the electrophysiology area. A final point, or another point, is a lot of adults now a lot of patients are getting into adulthood who have congenital heart disease. And so cardiac anesthesiology will allow you a wide variety of specialties depending on your interest. If you're interested in congenital heart disease, you can learn about that because the advantage that your knowledge will be needed as these patients become adults and require non-cardiac surgery.
Yeah, I think just the specialty is really going to expand within cardiac surgery, cardiac anesthesia, and you're also going to be taking care of a lot of patients in the non-cardiac ORs that have been patients of ours in the cardiac ORs. So I think I see it as a really great opportunity to become very well-rounded anesthesiologists and very confident taking care of some of our sickest patients.
Could not agree more.
Wonderful. I mean, I'm so excited about cardiac anesthesia as a specialty. And you talk about innovation. This course itself is another example of cardiac anesthesia taking the initiative in innovation for online learning and education. So I'm really excited about this course, and I think you guys will be too. So we look forward to seeing you in our next episode. See you soon.